I'm Caroline Ravello, a mental health advocate among many other things. But primarily, advocacy is my life at this stage and it's what I've committed to for as long as I'm here.
Welcome to Dependency TV,
reality TV at its best,
where every life is a biography.
I'm Garth St. Clair.
And I'm Natasha Nunez, and today on Dependency, we explore the topic of mental health and well-being from someone living and thriving with a mental illness.
We will also speak with an expert from the Mental Health Unit of the Ministry of Health about the support services available to individuals and families who may be dealing with a loved one with a mental illness.
Currently, I live with a diagnosis of clinical depression and bipolar disorder too. But I've had mental health diagnoses for just about 4 decades, since my mid-teens when I was diagnosed with early schizophrenia. And I feel like I have a cocktail from then to now, because as my life progressed and as my body changed and as my circumstances and environment changed, my diagnoses have changed. The fact that it impacted on my economic well-being. I left the workplace, and I like to say I pre-retired myself in my early 40s. And it was more out of the frustration of having employers not understand when I needed a day to go to the psychiatrist. As a matter of fact, being tired of hearing people look at me and say, "But you work so well, nothing ain't wrong with you." I got a little tiring after a while. So I think a huge part of the impact is on my financial life and my financial well-being. I also have had issues with my physical health, battling weight gain, weight loss, weight fluctuations, because of a number of reasons. One, in a depressive state, so very often all you want to do is just lay down, just stay on the bed and do nothing. And sometimes I'm in a depressive state and I share with people who live with my diagnoses, and they say, "Why don't you go to the savannah? Get up and go out of the house." I can't explain to you, if you've not experienced not being able to get off the bed, not being able to put the sneakers on, not feeling like you can open the front door because it comes with some anxiety sometimes. I can't explain that to someone. So I'd usually drop out of the conversation when people insisting that I should get up. Because the truth is, some days I just can't. And so retiring or pre-retiring myself from the workplace was a consciousness of the fact that I cannot do 8 to 5. And that the best that I did with my work, which means that I would work through the night because I sleep very little in the night. I would work through the night. I would send my work to supervisors and employers, and they still want to see me in the morning at 8 o'clock. That doesn't make any sense. That cannot be the life of someone who lives with the condition that I live with. I think too, in terms of other diagnoses, what I learned along the way, things that doctors hardly tell you, I learned about comorbidities. Because if you live with depression, and if you lay in the bed all day, and if you gain weight, then you go to the doctor one day and he says your blood sugar is high, pre-diabetes, and that's another stress level. So it impacts on your stress.
Actually, it's scientifically sound, and we've known how viruses have been transmitted for a long time. So it's applying these same principles to COVID-19, the pandemic, to protect ourselves. And if we follow these basic guidelines, then it radically reduces the ability of one person to pass the virus on to another. We also know, for example, though, that for health workers, they should have special masks. So, for example, they use N95 masks, which filter out 95% of the virus that can reach their respiratory system. So we know quite a lot about how viruses are transmitted. So it's based on science. It's not trying to make, create inconvenience. It is trying to save lives.
I think it's very important for the clinicians to discuss physical health with the client who has a mental ill health diagnosis. I think it's even more important that since we're opening up so much about mental ill health, it's more important for the client to ask. Because I have found a lot of times that if it's really like a don't ask, don't tell. If you don't ask the clinician, then you don't get the information. But I also encourage people to use the World Wide Web, because much of what I've learned and much of my advocacy came with the internet and with the availability of information on sites like Psychology Today, WebMD, and those are recommended sites where you can have information, and really good information. Of course, the caution is not to self-diagnose when you go to these sites, but at least to have an idea of what's happening and then pay a visit to your clinician if you think that something is wrong. Often, employers are unaware of what to do with a person who may disclose that they're living with a mental disorder. But more than that, what about the employees who are supposedly well? What do employers do? What are employers doing to ensure that they remain well? Because a lot of workplaces can cause you to be ill. And employers may be offended, but it's the truth. And the state itself, being an employer, would be the first place I would go. I would ask the government of the Republic of Trinidad and Tobago, what is your commitment to workplace well-being as the leading employer? In the Republic of Trinidad and Tobago, where the ministers of health and social development and so on continuously say that there's an increase in these diagnoses, where we have people who leave the workplace one day and we're in the funeral the next time we see them. And you have issues like that, and you may think, well, every man to himself, deal with your issues. But that's not so, because if I spend almost 60% of my life in the workplace, and that's cumulative, that's traveling to work, being at work, and traveling back from work. If I spend 60% of my life in the workplace, then workplace well-being has to be at the top of the priorities of the employer, as a responsibility to the employees, and then the individual responsibility of employees to ensure that their well-being is in a good place. I love that question for all kinds of reasons. So I was 15, almost to my 16th birthday, and I was at secondary school. And only last week I shared about it, the fact that I was feeling very pressured in my own life, pressured in my living situation. I came from abject poverty, so that was always a battle in the back of my mind. Never mind, my parents gave me all the comfort I needed. So much so I did not even recognize my poverty, but I knew something was different. And coming from abject poverty, going to secondary school and feeling very unsettled because of other things in my environment and in my life. At 15, when I had my first breakdown, it was in the middle of the courtyard, the school courtyard, in front of a population of over 400 students, because it was like the recess period. And I had to be hospitalized, psychiatric, and then I had to go back to school. When I was at the hospital, no one said to me what was wrong with me. I had a wonderful doctor, Dr. Masso, and I had a wonderful nurse, Nurse Jagannath, and I always remember them because of the care they gave me at the psychiatric ward in San Fernando General Hospital. But nobody said to me what was wrong with me, and I don't know if they told my mother, but when I went home, what I was Miss Verena, mad child. That's who I was. And it was a spirit lash because, of course, I lived in Moruga, home of Papa Niza, almost neighbor to Mother Conhusk, and all the myths about demons you can get, apart from Lescoto, is Moruga. And so I had been the recipient of lots of bathings and beatings and prayings and casting out of all kinds of things. And that's what I went through. So that understanding it was early schizophrenia only came much later when I asked the hospital to see my notes. Like, you know, when I was an adult, it's like, I'd like to see my notes. And I have seen my notes. And it's really funny because, you know, it's funny now because at 15, some of the things I said to the doctors, I'm thinking, but you were mad, you know? But that's the state that my mind was in. So no, we did not know it was schizophrenia. I found out that as an adult. Was that treated? Well, I got some really harsh drugs. I found out later that they were harsh drugs. They were what helped me. But if you ask me as an adult to take those medications, I would not, with the information I have on it. And then I had to go back to school and write exams, and did not pass those exams, and I had to repeat school. And the incident that I think really marked that repeating of the CXC and GC was the one where Penguin sang Look the Devil Day, the same year that I had to go back to school. And I remember my classmates, they made a banner that said Look the Devil Day, and they put it on my chair in the classroom during the break. So when I went back to the classroom, and my chair is at the back of the class, so as soon as I walk in, I can see my chair and there's something on it, and as I walk closer, it said Look the Devil Day. And that's what I had to deal with at that stage. I think it's really important for every one of us to appreciate and understand the expression suspending judgment. Now, suspending judgment is a learned behavior. It's something you have to practice. And therefore, if we're going to address stigma and discrimination, then it starts with the determination within each of us that we're going to be different in our response to these issues and to a person living with these issues. That to me is the greatest way to impact stigma and discrimination. Of course, I can give you a shopping list of things to do, but until we make individual decisions, that we will suspend judgment. And we do that with the understanding that someone living with good well-being is like 30 seconds away from a diagnosis. Grief, divorce, loss of any kind, even your own health, even in aging, those are issues that are common to all of us. And those are the very issues that can change your diagnosis from good well-being today to bad well-being tomorrow. And if we understand that mental health and well-being is not a lifetime diagnosis and you're stuck, but it's a spectrum of people moving from bad well-being all the way to good well-being. And you can have good well-being and you can have one challenge and you can move all the way to the middle here where your well-being is challenged. And after that incident, you can go right back to having good well-being. There's some people who have bad well-being or who have mental health diagnoses and who live with good well-being. I feel like I'm one of those because even though I have diagnoses and challenges, I live my life. I'm actively involved in living And I make a point of living. On the days when I can't move, I don't move. And I apologize to my body, and I eat the frozen food. And on the days I'm up and well, I'll be on the grill and I'll make my food. And so I have good well-being. I manage my diagnoses. I take my medication if the doctor says take my medication. I think the one challenge is to keep the physical activity going. That's my biggest challenge. Because if you live with mental health, it's really, really important to have some kind of rigor or some kind of routine of physical activity.
We're now closer than ever before. Yet it took social distancing to get us there. We're now more aware of how interconnected we all are. Yet it took a virus to teach us what was always obvious. We're more health conscious of ourselves and the environment than ever. Yet it took a global pandemic to create such consciousness. We're wiser now about the planet we share together, yet we just can't afford another lesson on how we need to live this life better. One way, one world. Live easy with Guardian Group.
This unit, it was established in 2011, and the reason for establishing this unit was to provide the leadership and coordination for mental health at a policy level, at a national level, for policy programs for mental health, as well as monitoring the standards of the service and improving the quality of the service delivery for mental health services across the regional health authorities. So mental health is an extremely important part of the public health management system. We need to recognize that the same social determinants of health are the same social determinants of mental health. And if I could just go back a little bit and talk about what mental health is. It affects the way we make choices. It affects how we cope with stress. It affects how we maintain relationships. It affects the decisions we make to encourage a healthy lifestyle. So it's extremely important that when we talk about having an effective public management health system, that mental health is well integrated into that, because it's an important component of managing your overall health. Okay, so mental health and mental disorders, we like to think about it as occurring along a continuum. So if you're mentally healthy, you may be on one spectrum of the continuum. And then on the other spectrum, we have mental disorders, where you would have met some clinical criteria for a particular disorder, and then many of them. So there are mood disorders, there are substance use disorders, there are developmental disorders, just to name a few. In between, there are a whole continuum of places where you could reside with regards to your mental health. And because you don't have a mental disorder doesn't necessarily mean that you're mentally healthy. And similarly, if you have a mental disorder, that does not mean that you can't go on to be well-functioning and live a very productive life and contribute to your community, which is part of the definition of mental health. So you can display very mentally healthy attributes despite having a mental disorder. When we're looking at how people develop a mental disorder, we have to look at the life course approach. So how people, from the time they're born, how they grow, how they live, how they work, contribute to their communities, and how they age. So we're looking at that mental disorders can occur at any stage along the life course. So for example, let's look at prenatal care. Exposure to toxins could influence brain development, even in utero. So that's one risk factor that can increase your chances of developing a mental disorder. It's not inevitable, but it's one of the factors. Developing a mental disorder, I should say, is very complex, because we are mitigating both risk and protective factors. So if there are a presence of a number of risk factors and a dearth of protective factors, the likelihood of developing a mental disorder is greater. But of course, once there are those protective factors, it can create a buffer so that mental disorders are not inevitable. We were talking about the early life course approach. That early parent-child relationship or caregiver-child relationship is also very important in terms of secure attachments and how people go on to form relationships and social connections later on in life. So this is one aspect of the definition of mental health. So of course, these early life experiences, again, can contribute to the development of a mental illness later on in life.
Okay.
So let's say someone is neglected or has experienced severe neglect. They may have trouble forming secure attachments in relationships based on these early caregiver-child attachments. So unemployment is a big risk factor for the development, a strong risk factor for the development of mental disorder, particularly depression. So I should say that there are common mental disorders, and the two common ones are depression and anxiety. And it's interesting for us to explain that, because the risk factors for common mental disorders may be different from the risk factors for severe mental disorders. And those severe mental disorders would be like bipolar disorder and schizophrenia. So we're talking about common mental disorders here. This is where we really need to focus some of our efforts, because a lot of the population may be suffering. I think the global prevalence of depression is 4.4%. Of persons worldwide are suffering from depression, and it's the leading cause of disability and ill health worldwide. So it really does bode well for us to invest in treating depression and protecting against depression, because depression, it results in a lot of years lived with disability, a lot of loss of productivity. So it has social and economic costs. It affects the family. So persons who just experience this unemployment, they are at high risk for experiencing something like depression. That low mood, that feeling of helplessness and hopelessness that are hallmark of someone who's depressed. So employment is actually a protective factor. So if they're able to bounce back or find another opportunity or be able to use their skills in other ways, this will help them. That alone may help them to overcome or not develop a mental disorder.
Agricola Credit Union Cooperative Society Limited introduces its new and improved mortgage loan package from as low as 5% per annum. Home renovation, purchasing a home, constructing a home. Come to your credit union today. Speak to our friendly and courteous staff. See your dreams come true. All lending criteria apply. Check us at our head office, 20 Phillip Street, Port of Spain. Arima branch office, Pro Queen Street, Arima. Tobago office, Plymouth Road, Scarborough, Tobago. And our Marabella office, Pamela's Mall, Marabella. Agricola Credit Union, your very own, working for you. Some of us like to play games of chance, but remember, gaming should be fun, so don't get carried away. Play for a prize, but don't pay the price. Play for fun, but never for keeps. Play smart, but never play all. Winning isn't everything. If you or someone you know needs help, call our gambling addiction hotlines. Rebirth House 24-hour hotline 466-3146 or Serenity Place Empowerment Center for Women 648-5401. An initiative of NLCB and Eye on Dependency.
So the stigma is actually a global problem, and there's a lot of research on stigma and what works, what doesn't work. There's not a lot of things that work, but I'll try to explain what does work or what the research suggests is better than other things. Contact. So contact with persons who would have had or have a mental disorder and are in recovery. So you can see them functioning despite their very debilitating symptoms and distressing symptoms. You see them going about their lives, working and managing okay, despite all their challenges. This is a major contributor to decreasing stigma. I remember one time at the unit, we had a summer internship program, and we had a summer intern. He must have been about 16 years old. And we took him to the Pembroke Street Wellness Center. And there was a group going on for persons with schizophrenia. And when he went there, he saw them talking, laughing, participating, sharing food. And he was like, but these people seem so normal. He's like, you sure they have schizophrenia? We're like, yeah, these are people who, suffer with mental illness. And I think this is the reaction most times people interact with someone who they know have a serious mental illness and see them in a light other than when they're in an active phase of their disorder. So I think it's really important to have this contact. A lot of this speaks to the model of care that we're moving towards for Trinidad and Tobago. No longer do we want this asylum type care, because this asylum type care is just reinforcing that stigma. You see, when you have to go to St. Anne's Hospital to get treatment,
Right.
that is strongly reinforcing the stigma for mental illness, because people know what happens in St. Anne's Hospital. You're locked away. It's an asylum and it's archaic. What we need to move towards now, and what we have been working assiduously for, is the decentralization of mental health services. So what the decentralization of mental health services does is that it places your mental health services within your community. So I live in St. Augustine. I suspect I have depression. I can go to my health center and tell my doctor, listen, I think I've been crying nonstop recently. I don't understand where these feelings came from. I think something is not right. Your doctor should be able to assess you and determine whether you may have a depression or you may have depression, and they can either treat you right there at your health center, your local health center, or go and refer you to a more specialized service if they deem that's necessary. So refer you to a service which is also not in St. Anne's, maybe in a general hospital. You might be suicidal, so they may be able to treat you in a general hospital setting versus going to a psychiatric hospital. So that also would contribute to diminishing the stigma associated with mental health. And I think the more people are open to talking about it, that definitely helps. More people are educated about it. So education, mixed reviews in terms of the research, in terms of whether education really works, but it can help. Mental health literacy at a young age, it can help with stigma. Well, we have several public health facilities where persons can access help, and there's actually a directory of mental health services that is available on our Ministry of Health website. It's in the process of being updated, but to give an overview of what types of places you can go to get help, there are some wellness centers in the Northwest region. These are 8 to 4 Monday to Friday, so you can just walk in, you can call them. There's a number and address on the directory. You will be able to seek mental health services there. Apart from that, many of the health centers, they have psychiatric outpatient clinics on certain days, so you can access care there. But like I was saying, one of the programs that we rolled out is something called the Mental Health Gap Action Program. And what this has done is train your primary care physicians at your health centers how to identify and treat some common mental disorders. So for example, depression is one of them, suicide, psychosis, substance use, epilepsy, dementia, child and adolescent mental and behavioral disorders. So they should be able to identify, screen you for these disorders, treat you to some extent if they're capable, because they will know what they're capable of doing and what they're not. And if they're not, if they don't have the resources to treat you there, they will refer you to a specialist who can follow up on your treatments. So that's really the starting point, or the contact of where people can go to seek help. But we have to remember that the Ministry of Health or the health services are not the only providers of mental health type care, because some of it involves counseling, for example, conflict resolution, mediation. All of these things help with your mental health, building self-esteem, stress management. So there are other ministries that provide services related to mental health, including the Ministry of Community Development, the Ministry of Social Development and Family Services. Aside from the NGOs, well, there's Lifeline. There's Lifeline, which is for befriending persons who are despairing or who may be suicidal. There's Families in Action. So there are many NGOs who work well to address persons with mental illness. Aside from the NGOs, you have technology these days. So there are many apps, there are many websites that persons can go to just to get a little bit more information. You want to know more about something, you type it into Google and you get the list of symptoms, what a depression looks like. There are really great apps also, something called WhatsApp, instead of, similar to WhatsApp. That will help you to break like negative thought cycles for persons with anxiety and PTSD. So there are a host of resources that are available, starting with the clinical services, but we don't want to wait till you get there. If you notice that something is up, there's a lot of prevention that you can do, starting with talking to a trusted friend or family member. So we need to remember that there are different layers of the society and we all have a role to play. So one of the most protective factors for persons who are at risk for developing a mental disorder is a stable relationship with an adult. So this is for children. Having a stable, positive, healthy relationship with an adult can be a huge protective factor for a lot of children who are at risk. So we want to push that and kind of be your brother's keeper, help everybody to know what their role is in managing mental health and maintaining their own mental health.
The diagnosis of a mental disorder is not a curse. Treatment is available and medication can help relieve symptoms. It is possible to live a full and rewarding life with the support of friends and family and colleagues who may understand their roles.
Join us next time for another informative edition of Iron Dependency TV. The topic, the Big C, cancers that affect women. See you then.
On Dependency, reality radio at its best every Sunday from 6:15 to 8 p.m. on I-95.5 FM. Don't miss it.